Going back to a dentist office during an ongoing pandemic doesn't sound like the best idea, I'll admit. Not that it's ever an enticing proposition for many of us. But the U.S. Centers for Disease Control has cleared dental offices to reopen for routine care, with proper safety controls adopted.
So we're just going by and whatever I can do, whatever the patients are willing to have done at that time, some of it what they need to get done. But there's more elective things that right now are probably going to be put on the back burner for a lot of people.
Miami dentist Ramon Bana continued to provide emergency services during the peak of the outbreak, but most of his staff was furloughed until mid-May. Now that his office is fully reopened, new protocols are in place.
We always obviously wear masks and eye protection, but now we've implemented the shield. We're taking patients' temperature before they walk in and ask them to wash their hands, sign a few documents. So just making sure that we are taking a few more steps into account as far as the procedure goes when they come in.
I also noticed a second person during my cleaning. That was new.
So why the second person?
Well, because of the aerosols, just to keep them under control, and that's why, again, we have now a shield and the 2 types of suctions. So that's why the assistant comes in to help me if that's the case that we need to use it.
Dental offices already followed some of the strictest standards for cleanliness implemented during the HIV epidemic in the 1980s. Now they're adding even more measures.
I purchased 2 of these units. If you can see here, these are surgical clean air purifiers. It's eliminating almost every microorganism that is in the air. But these will pick up everything. Not only do I have these, which is probably more than enough, and each one of my air handlers, I have a UVC light. So UVC lights are the lights that we know already kill SARS and MERS. And they're in the same family as COVID-19, so the likelihood that it's going to do the same is highly probable. I then have my office chemically sterilized. I then have my ducts chemically sterilized. So we did everything that I feel is necessary to do to maintain, the health for my staff and for my patients.
Judith Navedas, my dental hygienist, was unemployed for about a month and a half. She's happy to be back doing what she loves and getting paid.
I feel that even though we've only been open for 2 weeks and we've had a really good response from our patients, so I think that's probably the best thing to say, that everything looks positive.
As a patient, I had to follow more instructions. There were no other patients in the waiting area, and I felt safe with all the new guidelines. The question is, how long will it take for most people to feel comfortable enough to return? And how many dentists can financially survive the wait on top of the increased costs of infection prevention? Nitza Soledad Perez, CGTN, Miami.